Welcome to the New York Professional Spotlight. Host Roman Kirzhner sits down with successful professionals from across New York to uncover the stories, strategies, and expertise behind their achievements.
Hello everyone. Welcome to New York Professional Spotlights. Today our guest is Rowland Mayor. He is highly professional, board certified orthopedic surgeon, and we're happy to have you here. And we will discuss your strengths, challenges, and success, actually. And the first question, obviously, will be about your business. Can you give us a quick snapshot about your business, what you're doing?
Sure. I am a orthopedic surgeon with a focus in sports medicine. I was a fellowship trained in sports medicine. Joined a private practice in the New Haven, Connecticut area 30 years ago. Though the practices have changed with lots of mergers and acquisitions and splits in the last 30 years, I have maintained a presence in private practice ever since. I'm currently working with a large orthopedic group centered in southern Connecticut with about 60 other orthopedic surgeons covering all facets of orthopedics in southern Connecticut.
Yeah, absolutely. Your profession is in need and
Yes.
getting better and better. More and more people breaking something.
There does seem to be a lack of demand, either
Yeah.
breaking or wearing out.
All right, and there's many professional, talented people in your profession. What sets you apart? What comes naturally to you that other probably will find challenging?
Well, I think mostly the thing that I pride myself on and that may well set me apart is communication. I think I am able to listen to the patient's complaints and concerns and issues and challenges, and try to customize the treatment plan based on what the patient needs, what the patient wants, and what they see in their lives as um, problems that are coming up because of orthopedic challenges. And then also being able to communicate to them what the orthopedic science and literature is in ways that they can understand, and then we can help to come to a decision and to a course of treatment together, with using my knowledge and expertise in what's possible and their knowledge in what is necessary in their life and what's needed. So the combination of what's possible and what's needed hopefully gets us to an appropriate course of action.
Absolutely. Like in any business and in healthcare and in your profession, everything is based on the trust, and that's what you just described, basically. People and patients should have trust in the doctors first. I believe that's understanding
Yes, well,
general.
without the trust, you can't go any farther. You can't. That it stops there if there's no trust.
Yeah, absolutely. Uh, in your profession, obviously, like in every other profession, what has been the biggest challenge, and how did you face that challenge, and how did you learn, and what did you learn from that?
Well, I think historically the biggest challenge has always been the U.S. healthcare system and the third parties that try to intersperse themselves between me and my patients, and set up unnecessary and additional obstacles to doing what seems to be the best course of action. And so, one way you try to combat that is having data, having science to back up what you're saying, and trying to be able to communicate that in a convincing and persuasive manner so that you can convince those third parties to get out of the way and allow you to do what you want to do. And most of the time that's possible, but sometimes they are remarkably obstinate and difficult to overcome.
That's true. That's absolutely true, and it comes to every aspect of that. When it
Yeah,
comes to healthcare, that's the issue.
yeah.
uh, in your practice, what actually uh, kind of next goal do you have? What kind of methods and new techniques you can share maybe with the people? What you do for the next, let's say, 6 to 12 months in terms of something new?
Well, I'm working on trying to get approval to start using a new technology, which is an implantable shock absorber device, which um, hopefully will allow me to address the condition of early osteoarthritis of the knee in a patient who wants to remain active and does not feel ready to go to a knee replacement. And so again, it's seeing some resistance to new technology and new procedures that are different than anything we've done in the past. Those are always very hard to convince the third-party payers and the hospital systems to allow me to do that. And so I'm facing some resistance to that, but I'm hopeful that I'll be able to come up with a way to demonstrate the value of that approach and hopefully demonstrate good results so that we continue to try to address people's concerns without unnecessary intervention.
Sure, absolutely. Thank you. And that's probably good good points. Good points. And you have pretty significant career. You've been doing it for years. And if you can, maybe you can, maybe you cannot. What was the turning point that helped you to elevate you to the position that you have right now as a
Well,
surgeon?
I don't know that there was one single turning point. It's really been a long and a journey full of many twists and turns. I think you know, the recent turning point was our joining the current practice, which is a merger of multiple different orthopedic practices that used to be smaller in southern Connecticut into one large conglomerate, which obviously comes with some challenges. You know, the size does come with some challenges, but the size also has allowed a certain amount of stability and ability to negotiate with some of the other players on a more level playing field. And so I would say it was about 12 years ago that my smaller practice joined several other practices into a larger conglomerate. And we've since added a few more practices and become even more powerful to the point now where we are the largest group in the state and able to therefore have some power and some say in our own future directions.
Yeah, yeah. I'm thinking about you as a surgeon, and it looks like every surgeon has to be like a leadership, have have some kind of leadership skills, I would say.
Well, there's no
And
question that any surgeon in the operating room, you're the captain of the ship, and you have
right,
to be the captain of the ship. And anything that happens in that operating room, no matter who is really responsible, it is ultimately your responsibility as the surgeon. And so every surgeon has to be able to take on that kind of a role and that kind of a mantle.
it didn't happen instantly. It probably took some time. I don't know if what kind of lesson you can share about leadership in that profession, in that operation room that you can share with
Yeah,
people.
well, there's no question that I still remember moments early on in my career when when just after finishing medical school and beginning to start my residency as a new physician, when something happens and the instinct is to say somebody should call a doctor, and then you have suddenly realize, oh, that's me. so, so there are always those moments as a young physician where suddenly you realize, oh my God, I'm the one that has to take the helm and to steer this ship. And so, it takes different people different amounts of times to actually be willing to take that role. But I think without doing that, you really can't be successful in this field.
Absolutely. besides the skills, it has responsibility on the top of it. Absolutely. Yep.
In some ways, you want a little bit of arrogance in your surgeon, not too much, but just enough.
Yep. Absolutely. Congratulations, doctor, on things going well in your career. Now many people in your field in surgery and healthcare doing really well when they working. But if they will stop working, they worry about probably the income can dry up, or maybe slow down, or maybe wiped out.
Well,
Some
no question. I think that's true for any professional that when you end your primary career, there's a challenge of how do you try to maintain your lifestyle, and I think it's also difficult but possible to take a look at yourself and have a real um, assessment of what are your strengths and abilities, and is there a way to apply that any other way? Because it won't be too long for me before I'm at the point where the best use of my skills is no longer going to be in the operating room. But I still will have skills and abilities that could be leveraged in the world to continue to make a difference in some other way. And it's just a challenge to figure out where is the best way to apply that.
Yeah, and a lot of people in your profession basically looking for another sources of income when they will stop working. They looking into stocks, bonds, cryptos, etc. What are your thought of creating income outside of work?
Yeah, I mean, obviously income is one thing, but also it's you know, when you're a physician and working as hard as we do, when you stop doing that, it's a challenge to not be bored, to actually find something to fill your time, and it's also a challenge to replace it with something else that also impacts the world. As physicians, we take great pride in the difference that we make in people's lives on a daily basis. And it's a challenge to find somewhere else where you can feel like you make that same kind of an impact on the world. Because that's really what it's all about. That's what everybody really strives for. Is I want to make the world a better place because I was here. And so trying to continue to be able to make that kind of an impact after your career ends is always a challenge.
Your footprint after we're all gone, right? That's important. Absolutely.
Right.
Yeah. And if someone would like to connect with you, what would be the best way of doing that?
Well, I have a presence online where I'm with Connecticut Orthopedics, which is a large orthopedic group. We have our website, which is ct-ortho.com, and you can find out all about our practice and all about me and my practice on that website. So I can be reached through there. That's probably the best way to get a hold of me.
Absolutely. Thank you very much. Thank you very much, doctor, for your time today. It was short, but it was productive interview, and congratulations to your success.
Thank you very much.
Thanks for listening to the New York Professional Spotlight. If you're a successful New York professional with insights to share, visit nyprofessionalspotlight.com/guest and apply to be featured on the show.